All right, whenever you're ready.
Yeah, so I like the list that you sent, those suggestions of what to focus on. So
Okay.
we're going to talk about mental health. What's the difference between the first question was between mental health and mental illness. So it's kind of, we use interchangeably. A lot of people that do that. And the difference is basically a healthy state and a state of illness that, just back and forth. So according to the World uh, Health Organization definition of mental health in 2001, I looked it up. It is a quote. It's mental health is a state of well-being in which a person can cope with normal life stress, work productively, realize their abilities, and contribute to their communities. That's how they define mental health. World Health Organization defines it. And then the mental illness, according to the American Psychiatry Association in 2013, they defined mental illness as a clinically state of clinically significant disturbance in a person's thinking, emotions, or emotional regulation or behavior that cause distress or impairment in functioning. So it's pretty straightforward. If you notice, the difference between the two is a well-being versus loss of well-being. We use in psychiatry. There's a lot of kind of back and forth. There's no agreed upon definition of what disorder is. What is they go back and forth, and the final thing that they kind of agreed upon is just call it a disorder, which can become subjective because what is it can involve a loss of meaning in things that loss of meaning in life, loss of purpose, and those are all kind of dependent on faith, cultural experiences, overall outlook in life. So that's why people come in different colors when it comes to mental illness, and treating it also is challenged by that. My definition of mental illness or mental health is, let's start with mental health. How I, based on what I see and what I, in my clinical experience, is being able to, when a person is able to care for themselves, there are other responsibilities, including job, home, family, community obligations, all of it encompassing, being able to do that, and also noticing when that ability is kind of lacking or being reduced or getting lower and lower, and being able to bounce back, knowing what to do about it. So that's mental health. It's a spectrum, and we can be in different state in that spectrum. When it's worse, and the magic is just being aware of what your warning signs are, and knowing what to do, like what changes in your body when you're kind of heading the other way, the disordered way. And then when it, mental illness happens, is you notice the person is experiencing a disturbance in their thinking. There's conditions that we call the thought disorder conditions. Those are psychotic-based conditions: schizophrenia, schizoaffective disorder. And some people have some what we call personality type schizotypal. And those all involved disturbance in thinking, the ability to intellectually kind of examine reality. And the other part that mental illness impacts is the emotional ability to feel different emotions and kind of receive different signals that you receive from the environment. And that can involve social kind of interactions and relationships, depression. All of these kind of impact, bring on a lot of different conditions that we know, including psychosis, depression, anxiety, OCD, all of it impact all of these things. Intellect, emotions, and the physical. The person could have some physical issue going on. They are low on iron, or have anemia, or they have thyroid problems, or there's other medical condition that causing a lot of inflammation, and the symptoms that can lead to mimic depression symptoms. So that's another way that mental illness can impact in the human self. spiritual is different. There's a spiritual component. So when your spiritual kind of ability is lacking or low, you're susceptible to not being able to bounce back to health. Okay, so what I kind of put down, for example, I said, being in tune with your emotions is really goes a long way. That's why doing these things and having, teaching members of the community, individuals, family members, learning about what is mental illness and what's mental health, it's very helpful because if you don't know about it, you won't know to seek help, and you would be kind of at the mercy of people calling different things, and assuming things are not actually true, or waiting too late until things is the symptoms are very severe. That's hard to control. So what are some of the early warning signs that are important for people to know is energy level. Knowing with your energy level. Your energy level might not be the same as me. Some people are high energy and they function really well with that. And then, they notice when that's kind of lower. And it's natural sometimes to go up and down you don't expect to be happy all the time. You don't expect to be fully energetic all the time. But kind of knowing when it's like really problematic or disordered. Sleep pattern, pulling out all-nighter, doing your homework or whatever work responsibilities. Maybe easy for young people. Maybe they do 2-3 nights and then they're able to fall back asleep and sleep like 18 hours. But some people, they don't sleep, at night and they get really sick. So just knowing when your body is like, you need to sleep, but you can't sleep. What is that? What is causing it? That's what is something that's out of your ordinary, out of the ways that you yourself is. Knowing that about yourself, knowing when responsibilities are too overwhelming and when to take a break. Those are the kind of checking for triggers. Like what is it that's happening? You need to pause and reflect and notice what is changing. The changing appetite, changing sleep, changing interactions with people. How I used to interact with people. People can comment, okay, you're more kind of irritable. What is going on? It's kind of having good social supports where those kind of their observation can be, you can get that feedback from them is really helpful. All right. So the second question that we want to talk about is the why is mental health stigmatized in our communities? I assume you mean the immigrant community, Muslim communities, kind of minority communities. My understanding, or like based on having been in the healthcare field for 25 years, I can't believe it's been 25 years since I came to the United States. I've been in the healthcare field in different capacities. It's mental illness is the one thing, or anything that has to do with the mind and the mental well-being of the human. It is very complex, multifactorial. And in my opinion, the brain and the heart and the whole thing that allows us to function in life is the most important organs in the human body. Losing that ability to take care of yourself, take care of others, ability to think, perceive the world in a manner that's real is basic. When a person loses that, they're not able to do any of the other things, right? They may be eating, drinking. Sometimes they leave that because of that. The other thing that I think leads to the high stigma associated with mental health stuff in our communities is we're not familiar with it. We're not familiar with the symptoms. We're not familiar with the treatment associated with it. There's a lot of myths out there of what happens when a person takes medications or goes to therapy. A lot of misunderstanding. So that lack of familiarity, it's the fear of the unknown, is contributing to that. I also think having personal experiences with, not personal, professional experiences with this, is language plays a really big role. The language that we use, different cultures, like Somali, emotions is not well expressed. So I remember, 2005, I didn't I didn't even have the words to express anxiety. What does it feel to be disappointed? None of that. All these emotional states, I still struggle to can't find the words in Somali. I can't. The language is not part of it. It's a culture of nomads and kind of always you have to be resilient, highlight on your strengths and not, they're not in touch with their, I wouldn't say maybe I don't know enough Somali to express it, because Somalis are known for poetry and that involves a lot of emotions, a lot of language being used. But I think given that we're living in a Western society where, English is a primary language and a society that's highly expressive in an emotional terms, there's that clash. And I see that in the elderly, you ask them about how you feel and they just look at you dumbfounded. What do you mean feel? Like, just that language plays a big role, I would say, in how to express emotions. The other thing is fear of being labeled, like highly stigmatizing societies where everyone to kind of be at their best and kind of put up a good front. And, that kind of leads to wanting to, trying to avoid to be labeled. Because what does that mean? You have less, you're crazy. If you're crazy, you'll never get better. So that fear is driving a lot of people away from seeking help. People with addiction issues, they're very fearful and embarrassed about it. Fearful that what it'll lead to loss of family, loss of jobs, all that. So a lot of those emotional things, the thought processes that go on when a thing is like stigmatized and you don't understand it, leads to people going for years not treated and struggling, and the condition is getting worse and worse. Okay. Now, I think there was a third early warning signs. So that depends. That people ignore, you say, and was the kind of the question. What are the early warning signs that people ignore? That depends on what type of condition it is. I know psychosis, for example, schizophrenia, there's a period that we call prodromal, meaning before the psychosis onset. Typically it happens 19, 18 for boys. Girls are a bit later, 20 years or so, kind of right after puberty. It happens most of the time. What people kind of should pay attention to, the early warning signs of schizophrenia, is loss of ability to to engage in life. Very tired, isolative, not taking care of themselves, not showering, isolating in their rooms, becoming more angry or irritable, a lot of sometimes disinhibition, saying things that they normally don't say, or the overt signs and symptoms of psychosis, like hallucinations, delusions. Those usually come later. But in the early symptoms are loss of motivation and drive. All those things can diminish. Takes about a few months, and then the person has a break of full-blown psychosis. With depression, I would say, things that are noticeable that people ignore is easily angered, changes in the sleep pattern could be sleeping more, sleeping less, changes in appetite, sleeping more, like eating more, eating less. Those are kind of noticing those things. And just like I said earlier, being in tune with your emotions and what kind of your thoughts, emotions, and behaviors, and noticing if there's any change and to what degree, because all of these things are dependent on different severity. All right. The last one, supporting, how do we support others without judgment? So it ties in with the stigma. And I think as the clinician or as the person who's supporting, as the mental health practitioner, I think it starts with yourself, checking your own biases and attitudes towards mental illness. I remember, was when I was in school for actually RN school, nursing school in 2008, if I'm not mistaken, or 9. I was doing my clinicals. It was the first time I was in a psychiatric hospital, adult psychiatric hospital. And my teacher, a lot of my cohort students were walking in the hallways, and I was in checking on patients' rooms. I happened to be the first person to check that room. So there was a little window that I looked through, and the person had their blankets open. So they did this and looked at me, and I'm looking at them through a little window on the door, and I jumped backward. Everybody, what happened, Khadra? And I'm like, they looked at me, and they said, what do you mean? And they said, he's going to get up and hurt me. That's how fearful I was. That stigma that society has, and thought that he was going to jump out and just beat me up. Those things that you watch on the Investigation Discovery and those shows that I used to watch when people have mental health conditions, kind of the worst case scenarios. They're violent. It's some people would say contagious. If you work with people with anxiety, you can get anxious yourself. Those things are out there. So I was part of that society, that stigma. And fast forward, I've learned that people with mental illnesses are not more violent than other people. They would walk around in these hallways at ease without feeling that, being afraid of anyone. Doesn't mean that violence doesn't happen in psychiatric hospitals. It does. But kind of knowing that, having learned that. So it's work that you do by practicing and kind of being out there. So what I would say to people who are kind of starting out and helping people out is check your own biases, kind of, and seeing, understand what mental illness, that it doesn't discriminate. Anybody can get sick. A lot of it is not seen because it's not tangible. It's not observable most of the time. Sometimes you can, if the person is functionally impaired, or, there are some conditions that you can observe. And, if you have a conversation with somebody who has thought disorder, you can observe their disorganization and all that. Yeah. So one thing that really works, and I think is basic, is active listening without judgment. That allows you to not only assess the status, what the degree of the disorder, if that person has a condition, but also that person, might not have anyone to talk to. And you're the only person who is kind of giving them the attention that they need and listening to that and letting them kind of say it out loud, things that they would otherwise be thinking about it, and alone with it. That listening, also active listening, might allow you to notice things that the person might be blind to. When you're actively experiencing yourself, the condition, for example, depression, your severe depression, the person loses insight. Mania, same thing. So those subtle changes that are happening within them, maybe, if you listen actively, you will notice and be a person that prompts them. Okay, is this something going on? Can I help you? Or get them to the help they need. When there's a type of psychotherapy that I think everybody should know and learn about, it's called supportive psychotherapy, that we use pretty often. And pretty much what it involves is active listening, validating the person, empathy, being empathetic, putting yourself in their shoes, kind of, that allows you to not be judgmental, encouraging the person about, and highlighting their positive attributes. Because what happens with depression is your thinking is skewed to the negative. And our brains tend to kind of hyper focus on the negative stuff, things that are going wrong, and we take the things that are going right for granted. So if we flip that, and focus on the things that are going well, it helps it's the antidote to negative thinking. Reframing, when a person's talking to you, telling you all these things, something bad is happening, I'm a bad person, I did this wrong, and all these negatively oriented thoughts and belief systems, you can help them reframe and say, okay, there's other ways to look at it. And, what about this way? And kind of help them see there's other ways of looking at things. There's positive ways of looking at things. It's not black and white. problem solving, helping them problem solve. If you're able to do that as their clinician, and this one, the psychoeducation piece, part of the psychotherapy, requires persons to be clinician and licensed and knowing what they're talking about. It's like how to teach a person about the condition that they have, the triggers, the symptoms, and how to cope with it, the coping strategies. Insight building, helping the person kind of gain insight into their condition, help them see things that they cannot observe in a way that's non-judgmental, that they want to listen to you, which I think the foundation of all of that is that trust and rapport building. Helping the person build up their self-esteem, especially self-esteem, low self-esteem, worthlessness is part of anxiety and depression. When a person is you're listening without judgment, they're more open, they're more likely to open up and share things that they wouldn't share with other people, because they put their guard down, and share that with you. And you might be the person who's gonna be the one preventing them from, let's say, if someone was having really active suicidal, severe suicidal ideation, and they disclose that to you, being able to know what to do and help them to seek the support that they need. I think that's all I got together. Yeah.
Thank you so much, Dr. Khadra. We appreciate it.
Yeah.
Let's see. Stop recording.